The government will start random screenings on Saturday in its intensified surveillance against the new coronavirus. Health CS Mutahi Kagwe says over 600,000 people have already been screened at all entry points in the country. The government is also moving to tighten monitoring of Kenyans with the involvement of chiefs, sub-chiefs and nyumba kumi elders. Here's Stephen Leto starting our bulletin off.
The government is leaving nothing to chance, now announcing plans to begin screening Kenyans to identify whether the virus is spreading undetected.
We will embark on random screening in targeted areas for members of the public, commencing this Saturday, March 21st, 2020. The exercise, to be coordinated by the Ministry of Health, will also involve other stakeholders such as the Red Cross and security personnel.
Over 600,000 people have so far undergone the screening that had been mounted in all entry points in the country.
In the last 24 hours, we have screened and tested another 8 cases, all of which have turned out negative and are being processed as we speak to be discharged to go home. So this is good news that today we are not reporting any increase in the positive cases that we have in the country.
The 7 confirmed cases are responding positively to treatment.
The good news is that the 7 patients are in stable conditions. We continue to appeal to Kenyans in order to break the chain of transmission of this virus. We continue to maintain high standards of hygiene as we have advised.
The Health Ministry announcing an upscale in its manpower to crush the virus.
The Public Service Commission has today approved the remaining Ebola champions who have now been incorporated to assist in the COVID-19 response interventions.
The government seeking to enhance the battle against spread of the coronavirus by deploying chiefs, sub-chiefs and nyumba kumi elders to help in the effort.
The government has directed the involvement of the nyumba kumi leaders, sub-chiefs and chiefs in ensuring compliance to these directives, but also in creating the smallest units in terms of the management of the disease.
Businesses that will continue operating without daring to set regulations to lose their operating licenses. Kenyans asked to take the threat posed by the coronavirus seriously.
It cannot be unreal in Kenya when it is real in China, it is real in the United States, in Spain, in Italy, and we think that in Kenya it is something to joke around with. It is not.
On Wednesday, the World Health Organization raised an alarm that African countries were not able to assess the number of infections accurately because of inferior testing capabilities. But the health minister maintains the country's testing is up to par.
But it is also good to acknowledge that even the so-called able people are also totally overwhelmed. All right? So let's not always believe in what somebody out there. They have got a very dismissive attitude about what we are able to do. So let's not look down upon ourselves. Let's behave. If we behave, we will prove them wrong.
With the screening ongoing under the surveillance of the COVID-19 in the country, the government is employing all the tactics on its disposal to combat the virus and stop it from spreading to other Kenyans. Stephen Leto, Citizen TV, Nairobi.